Hello, it's Dr. Rhonda Johnson. Today's Thursday, June 16, 2022. This is part 2 of my update on the COVID-19 vaccines for children under 5. Now, again, you've heard that the FDA Advisory Committee has recommended both Moderna and Pfizer vaccines for children 6 months to 5 years, and I think it's almost certain that the CDC and the FDA are going to approve this. So parents are going to have two choices on these vaccines. As always, I advise to talk to your child's doctor about which vaccine may be best for your child. But here are some what I think are common questions that I would have for myself if I had children in that age group. So the first question would be, well, does my child really need the vaccine? And the answer to that is, well, what is the reality of COVID today? Well, there's a whole lot of COVID infections in children going on. According to the American Academy of Pediatrics, in the week ending June 9th, almost 88,000 child COVID-19 cases have been reported. And also, according to the American Academy of Pediatrics, nearly 400,000 cases have been added in kids in the last 4 weeks. So that's a lot of children with COVID. Now, there were 442 children between the ages of 0 to 4 who have died from COVID. Experts have said that may not seem like a big number. After all, we've had over 1 million deaths. But if you compare this number to other vaccine-preventable diseases among children, deaths due to COVID-19 are the highest. So the other thing is that there's the risk of long COVID, which does occur in kids, and vaccines are believed to reduce the burden of long COVID by 10 to 15% at least. Well, what about natural immunity? Because the CDC says 75% of American kids already had COVID, and your kids may be in that category. The challenge, of course, is that immunity to Omicron is weak and variable. The virus keeps mutating. As you know, there's all these variants and subvariants. And COVID can interfere with your T-cell mediated immunity. Those are your memory T cells. So again, they may not work as well, and you can get reinfected. We already know that you can get reinfected with these Omicron variants. Now, the reality is if your child has had COVID infection, gets vaccinated, they will have what's called hybrid immunity, which the experts say is stronger than both natural infection immunity and vaccine-induced immunity. Now, I'm sure parents want to know, what about these side effects? Well, it appears that the side effects were just like the adults, pain in the arm, localized swelling. But it does appear that more kids had fever after the Moderna vaccine. And this may be just because the Moderna dose is higher than the Pfizer dose. Now, none of the children had myocarditis in the clinical trials. But again, we don't know what will happen once more and more children get vaccinated. We just don't know yet. Are the vaccines safe? Well, the short-term safety has been established in the clinical trials. But parents, I know there's going to be some out there that want a longer period of safety data, like 5 years, but we just don't have that yet, and that's just a fact. So my advice is to parents, start thinking about this now. Be open. You're going to hear a lot of misinformation about the pediatric COVID-19 vaccines. I know that for some parents it's going to be a tough decision. Other parents, they've already made their decision and want their children to be vaccinated. But for those of you that are cautious or hesitant, talk to people that you trust, your child's doctors, talk to grandparents, talk to teachers, talk to your friends. I don't know who you can talk to, but get more information, do your research, and I think that will help inform your decision. That's my message today. As always, take care and be safe, and my views are my own.